Namaste. On behalf of Jyestha Nagrik Sangh, Nerul, we have some questions related to lungs cancer. Today we have with us Dr. Salil Patkar, consultant medical oncologist at Apollo Hospitals, Navi Mumbai. Doctor, we have a first question. What is lung cancer?
All right, so let's begin. I'll try and speak in, I think I'll stick to English. Yes. Okay. So lung cancer is basically what is cancer? Any cell that is abnormally dividing and is not in homogeneity with the rest of the body or the rest of the surrounding cells is a cancerous cell. An abnormally dividing, abnormally growing cell which is mutating is called as a cancer. Now that cell can arise in any part of the body. You can have a cancer of the lung, you can have a cancer of the liver, you could have a cancer of the bones, you could have blood cells which are rapidly and uncontrollably dividing, when we call that blood cancer or leukemias. There are more than 200 different types of cancers. Like I said, cancers are possible in every possible organ. So one of those organs is the lung, and then if you have cells which are growing abnormally and dividing uncontrollably in the lung, that could lead to a lung cancer. It is further divided depending upon the type of cell that it is. It could be an adenocarcinoma of the lung, it could be a squamous cell carcinoma of the lung, it could be a small cell cancer of the lung, and there are then even rarer entities. But the most three common types of lung cancers is an adenocarcinoma, squamous, or a small cell. And it's important to know the type of lung cancer, because your prognosis or the outcomes depend upon not only the stage and the treatment that is given, but it also depends on the type of lung cancer that the patient presents with.
So, what are the symptoms of lung cancer?
Okay. This is interesting because in our country there is always going to be a question mark of whether this is definitely lung cancer, because there is something else that mimics lung cancer very closely in our country, and that is tuberculosis. So patients of lung cancer usually present with cough, breathlessness, hemoptysis, which is blood in while coughing in the sputum. These are common presentations for lung cancer, and interestingly, these are also the symptoms that a patient with TB presents with. In fact, it is not uncommon in India, and I used to see a lot of that when I used to work in fact, government hospitals, that you always see patients who have been misdiagnosed at tuberculosis initially, and they take treatment for TB, and then they progress on TB, and they progress on the treatment for the tuberculosis, which is known as AKT. When they progress on that, then we used to do a repeat diagnosis of the patient. The physician used to find something wrong, so he used to send the patient to us. We used to do a biopsy, and then we used to find out that it's in fact not tuberculosis, and it is in fact lung cancer. Because even sometimes the X-ray findings can be quite similar between tuberculosis and lung cancer. And in fact, once upon a time we used to start empirical treatment for TB, say around 10-15 years back. If a patient came with cough and breathlessness, with a history of say 1 month or so, and we used to even see those ads being done by the government where they used to say, if you have persistent cough, go and visit a TB center, and you should start them empirically on TB treatment, based just on the X-rays. But what has happened in the last 15-20 years is, as India has developed, the number of patients who are now presenting with lung cancer has gone on increasing as you have more and more people having a more Western lifestyle, if I might say so, which includes smoking, alcohol, and foods which are more on high energy foods, high fats, high carbohydrate food, processed food. And so now the number of lung cancer patients is also increasing. So the gap which was there once upon a time between say TB and lung cancer in India is not so much so anymore. And so that is why today it's very important that we not misdiagnose a patient of lung cancer and treat him as tuberculosis, because then the disease progresses. And ever so often, I would say out of 10 patients of lung cancer that I treat, at least 3 of them have received anti-tubercular treatment before they come to me.
So, doctor, is lung cancer chronic or hereditary disease?
Is it chronic? If you are lucky, it is chronic. If you are unlucky, it is not chronic. Is it hereditary? No. Lung cancer is the familial incidence in hereditary lung cancer is very low. So do we usually check for familial or inheritant genes for lung cancer? No. Breast cancer is commonly hereditary, ovarian cancer is commonly hereditary, sometimes of prostatic and pancreatic cancers can be hereditary, but lung cancer per se is not hereditary. If you have a very strong family history, then you can go ahead and do a genomic sequencing, but then it would be a very rare representation.
So what is the treatment involved for lung cancer?
Alright, so treatment for any cancer, there are 3 pillars to the treatment. It includes surgery, radiation, and chemotherapy. Of course, that's more evolving now, but those are the 3 pillars of cancer treatment. And the same holds true for lung cancer. So it depends on what stage your patient comes in. Stage 1, you can just operate it and leave it at that. Stage 1 means generally a lung cancer where the tumor is usually not central in the lung, it's towards the periphery. It is easily operable. There is no nodal involvement. So surgery is enough in that case. Anything beyond that, a stage 2 or a stage 3 lung cancer usually will require curative treatment. It is curable, but it will require a combination of radiation and chemotherapy. Surgery is not an option at that stage. So for a stage 2 or a stage 3 lung cancer, in most cases what you would do is a combination of radiation plus chemotherapy. If it is a stage 4 cancer, the once upon a time the answer would have been just chemotherapy. Today there are far more options available. I think we'll be discussing that in the
So doctor, is chemotherapy necessary?
Is chemotherapy necessary? Like I said, depends upon the stage. In stage 2 and stage 3, yes, definitely. It is given in combination with radiation, and it is curative. So you must go ahead and take chemotherapy. Before we discuss the other options besides chemo, I think it is very essential to understand that chemotherapy is not as toxic as it once was. Say a decade ago, yes, side effects were very high. You had a lot of patients who used to develop a lot of nausea, vomiting, hair loss, diarrheas, counts used to fall, febrile neutropenias. All of that has come down tremendously now. So the amount of people who develop those kind of side effects are very few. The number of patients that I have who actually get admitted post chemo because of neutropenias or fall in counts or high fevers, I would say is less than 1% now. So that's a tremendous difference in what it was a decade back perhaps. But in addition to that, especially for lung cancer, especially in stage 4, you have other options available which are fantastic, which is the latest cutting edge treatment available. First part is molecular targeted therapy. I have discussed that briefly in one of those videos before, but in short, so for lung cancer, you have certain mutations which are known as driver mutations, especially for adenocarcinomas, and these mutations are responsible for the cell multiplying uncontrollably. They are responsible for driving the cancer, which is why they are known as driver mutations. In lung cancer, adenocarcinoma, you have 3 mutations which are known as EGFR, ALK and ROS. These are the most common driver mutations. There were huge studies which were done which found that the incidence was roughly around 15 to 20% in the Western population, but in Asian population, in fact, the incidence is even higher. We have around 30 to 40% of our patients who are positive for these mutations. And if you are positive for these mutations, you don't have to take chemotherapy. You have certain drugs available which are oral medications. So you can control a stage, not only control, you can control it very well. You can regress a stage 4 lung cancer without giving chemotherapy at all. What are the advantages? You can do it on an oral tablet. The patient requires no admission. Generally, the side effect profile is tremendously lower. There is no hair loss. Nausea, vomiting are minimal. There is no fall in counts. The patient does not have to admit again for adverse or side effects of the treatment, and they work better than chemotherapy. If you have the right sequence of mutations, you can have today a patient alive in a stage 4 lung cancer for well beyond 4 and 5 years. You can have you have an average life expectancy which goes beyond 5 years if you have an EGFR mutation for which you say start maybe gefitinib, which is an oral tablet, and if he mutates on that, and if it is a T790M mutation, which is again another type of mutation which has a targetable drug for it, then you start him on osimertinib, which is again an oral treatment, and the overall lifespan can go beyond 5 years, which is fantastic. There are not many people who many diseases or many types of cancers where you can say that the life expectancy could go in the range of 4 and 5 years if he has the right targetable mutations, and that also without any chemotherapy. So that is number one. Another thing that is very great advancement in lung cancer is the role of immunotherapy. Lung cancer is one of those few cancers where immunotherapy has a major role to play. Lung cancers, melanomas, renal cancers. In fact, in lung cancer, the evidence that immunotherapy works is so strong that there are only 2 companies in the world which make these immunodrugs. One is pembrolizumab, the other is known as nivolumab. And there are many more coming now. There is durvalumab, etc. But there are only 2 companies which by and large make these drugs, and the evidence that it works in lung cancer is so strong that you have patient assistance programs where they give you, nearly half of the medication free of cost, and they enroll you into this patient assistance program just to help you out. That is how strong the evidence is for immunotherapy in lung cancer. It depends upon whether you have certain markers in your tumor. This is known as PD-L1, and there is a score which you do, a CPS score. But if you are a candidate for immunotherapy, it can give a durable, very long-lasting response. and the response and the duration for which you remain in remission is unmatched by any form of chemotherapy. The side effect profile of immunotherapy is very, very low as compared to chemotherapy, because chemotherapy is a blanket therapy. Chemotherapy not only acts on the cancer cell, but it acts on every other cell in the body, which is why you lose hair, which is why you have diarrhea. On the other hand, immunotherapy does not touch the cancer cell at all. What the immunotherapy does is it reboots the immune system. The reason why a patient develops cancer and why the cancer progresses is because the cancer learns to bypass the immune system. Just like, say, a bacterial infection or a viral infection, usually your immune system, the white cells in in your immunity, the T cells and the B cells, they go and act on the bacteria or the virus and they kill it. What happens in cancer is that the cancer develops a mechanism by which they bypass the immune system. And immunotherapy does not touch the cancer cell, it reboots your immune system to go and act on the cancer cell. And which is why it has very minimal side effects. I have patients as old as in their 80s and I think even in 90s who are taking immunotherapy without any side effects. So immunotherapy is a fantastic modality of cancer treatment, especially in lung cancer, provided you are the right candidate.
So, doctor, which hospital offers such kind of treatment?
I think, by default forced to say Apollo because I work for Apollo. But I can tell you one thing with guarantee: Apollo has all the necessary setup that you need for cancer treatment. It has some of the best oncologists, some of the best surgical oncologists, some of the best radiation oncologists working. And I think we have all the necessary equipment. We have the most top-notch radiation center and the radiation equipment and the machines that are required. In fact, Apollo, we also have a proton center if you take all Apollos combined, which is the only one in the country. We also have dedicated PET-CT, immunohistochemistry, flow cytometry, genomic testing assays. So I think, as far as I am concerned, Apollo can match any hospital in the world as far as facilities go.
So, doctor, what are the death rates of lung cancer globally or in India?
Let's talk about India. Globally, they are much higher. Globally, lung cancer is the number of cancer among males. In India, we are catching up. In India, one of the reasons we are catching up is because tobacco is a major issue in our country.
Start the answer.
Okay, which are number?
What are the death rates of lung cancer in India?
So, what are the death rates of lung cancer? India is definitely a country where the lung cancer mortality is on the rise. Partly because you have now reached that stage where the Western population has more or less plateaued on lung cancer because of a very strong understanding that smoking is associated with lung cancer, tobacco is associated with lung cancer, and you have now the Western population which has moved away from smoking, and now you are seeing the benefits of that. So lung cancer has more or less plateaued in the Western population. The rate at which it is increasing is not as much anymore, and now you will probably start seeing a decline at some point in the Western population because of the changes they have brought in their lifestyle, including smoking and alcohol, which was very predominant once upon a time but has come down significantly. In India, unfortunately, tobacco consumption is still on the rise. We are seeing some changes in this, but still we are not there yet. In India, roughly around 70,000 people die of lung cancer every year. That's a very high number. Nearly 50,000 of them are males and around 20,000 of them are females. You would be surprised to know that even amongst females, the amount of tobacco consumption is quite high. If you go for the cities, then it's probably more of cigarette smoking. But if you go towards the villages, you still have a large amount of tobacco consumption in the form of gutka and chaini khaini and zarda amongst even village women. And another misunderstanding is that, just since we are talking about lung cancer and mortality, we have this misunderstanding that tobacco is responsible for only lung cancer. That's not the case. If you're smoking, you're exposed to not just lung cancer, where your rate increases by almost 15 to 20 times, but you're also exposing yourself to esophageal cancers, tracheal cancers, khane ki nali, saas ki nali, lungs, fepda, breast cancer, stomach cancers, colon cancers, matlab पेट का कैंसर, आंतड़ी का कैंसर, bladder cancers, kidney cancers, prostatic cancer. So literally every possible cancer is associated with tobacco smoking. Lung cancer has a higher risk, but the rest of them still have a relative risk of around 10 to 12 times.
So, doctor, how the progress of lung cancer is monitored?
Alright. So depends on whether it is curative or not curative. Even if it is not curative, if it is a metastatic or a stage 4 cancer, like I said, today you can have people living well into 3, 4, 5 years, depending on whether we have a targetable mutation. So we keep monitoring periodically, doing certain imaging tests. The basic test we could do is perhaps an X-ray. but that does not really provide all the necessary information. Usually what we do is in between treatment, and if we suspect progression, what we do is an imaging, ideally either a CT thorax, or we go ahead and do a PET scan, especially if it's a stage 4 disease, and probably a PET scan is the best way to evaluate intermittently, because it would give you a full body imaging, which again is available at Apollo.
So to prevent lung cancer, what exercise and what diet one should follow?
So there was a study. There are many studies actually, but one of the most landmark studies that was done was a trial known as EPIC trial. It was done in it was European nations, I think, and there were not just European. It was mainly European nations, but there were almost more than 23 countries involved, and it was known as the EPIC study. I think it was published in 2004. I'm not entirely sure of that. So they did around 5.5 lakh people were studied for why does cancer occur, and one of the main things that they found was nearly only 5 to 10% of cancer is genetic. All cancers combined. I'm not talking about lung cancer, just I'm talking about all cancers across the spectrum. 5 to 10% of all cancers are genetic, which means that nearly somewhere between 85 to 90% of cancers are associated with your lifestyle, right? Now that includes smoking, that includes alcohol, that includes many other factors which they found in this EPIC study. Some of those things I'd like to discuss, and this is also not just for lung cancer but for all cancers in general. They found that 20 to 30% of your cancers were associated with your diet. They found that your diet made a big difference. They found that people who had more of processed food, people who had more of high energy food high on carbs, high on fats, low on fruits, low on vegetables, low on nuts, low on legumes, they tend to have cancer at a higher risk, and the risk was almost as high as 25 to 30%, which is a significantly higher risk of cancer. We are already aware of the impact of tobacco. In India, they say that nearly around 70% of all cancers in our country are associated with tobacco consumption, which is a fairly accurate estimate, because you have to understand in our country it is head and neck cancers, which means cancers of the oral cavity, cancers of the lung, which occupy majority of the cancers in men. So 70% of all these cancers are preventable if we were to just give up tobacco smoking and tobacco consumption in the form of smokeless tobacco such as zarda, chaini, kaini, etc. All of that. Now, in addition to that, like I said, monitor your diet. There is not enough information that comes out in this case. For every, I think I've said this before also, for every 80 rupees or 1 pound that the World Health Organization spends to convince you of eating healthy, the fast food industry spends something close to 500 pounds, which is close to 40,000 rupees to convince you to have sugar, aerated sugary drinks and burgers and chips and pizzas and highly processed food. So you don't get enough information. But if you were to Google the right way, you will find out the importance of a diet in preventing cancer, 25 to 30% reduced risk. So something you should really take into account. I would urge all of you to go online and search for something known as the Mediterranean diet. It's very simple. There was a huge study which was done. Again, it was a landmark trial. I think it was published in NEJM or BMJ, which are again leading journals. Google Mediterranean diet and see the impact that it had on overall lifestyle, heart disease, cholesterol, diabetes, hypertension and cancer.
So doctor, normally what is the period of lung cancer cure from the date of diagnosis?
Okay, so cure, okay, let us assume that if it is curable, if it is a stage 1, 2 or 3 disease, so you would have to undergo a surgery for a stage 1 disease. If there is no further indication, then from the time you are diagnosed to the time of cure, post-surgery, if there is no indication for any adjuvant treatment, you are cured. Alright. If you have to go ahead with say a second or a third stage lung cancer where it is a combination of CTRT, which is you would have to give radiation along with chemotherapy, the average duration will be about 2 months of treatment at least. Okay. There are few trials now which say that even after giving CTRT, there is benefit to giving immunotherapy, which is a drug known as durvalumab, which is launched in India around say 5 or 6 months back. And so if you give that, you add another additional 1 year of treatment with immunotherapy. This is done so that the cancer does not come back, and there is proven evidence that if you go ahead with immunotherapy post CTRT, provided it is the right stage, it adds to your life and helps with the cure and helps it from coming back. So I'd say on an average somewhere between 2 to 6 months is the cure amount of time required to cure lung cancer.
So does pranayama help in controlling lung cancer?
I would like to make it a more holistic question. Does exercise help in controlling lung cancer? I'm not entirely aware of whether pranayama helps. I'm sure it does not help. It's not detrimental. Any form of yoga, if it can be undertaken, is always beneficial because it has been conclusively proven that I wouldn't say just yoga, but exercise in general has a very good impact. Not just in cancer prevention, where again exercise has been shown to reduce cancer by around 10 to 15%, but in patients who are undergoing chemotherapy, patients who are undergoing radiation, patients who are cancer survivors, there is tremendous amount of evidence which says that doing some form of exercise, whether it is yoga, whether it is just going for a simple jog in the morning or an evening brisk walk, has definite good benefits on your health, good benefits on your outcomes in terms of treatment, and like I said, helps prevent cancer.
So we come to the last question. Is it possible to make lung cancer free world?
If you could make it possible to give up on smoking and alcohol and tobacco, we could go in that direction. Is it possible to completely cure the world of lung cancer? No, because as you have seen, Mother Nature has a way of getting back, and considering the corona pandemic and everything. But is it possible that you could prevent lung cancer in your lifetime for you or your loved ones? Yes. You just give up on tobacco, you bring down your chances significantly, without a doubt.
Thank you, doctor, for joining this
Thank you.
session.